Hey future nurses, welcome back to Scrub and Spoon. It's your nurse here. Thank you for all your support on all the platforms. I truly appreciate it. Now today's Nclex review is on mental disorders like anxiety, depression, OCD, eating disorders, and antidepressants. So this is good for the PN and the RN students. So stay with me, watch till the end, subscribe, like, and leave in the comment section the best part of this review for you, and I will be reading and replying them. Thank you. Now let's go. A client on Clozapine developed a fever, agitation, and muscle rigidity. Which condition does the nurse suspect? A. Malignant hyperthermia. B. Neuroleptic malignant syndrome. C. Serotonin syndrome. And D. Lithium toxicity. And guys, looking at the signs and symptoms presented to you, fever, agitation, muscle rigidity, what is that telling you? That is telling you serotonin syndrome. C, and the right answer is C, okay? And what causes serotonin syndrome is either the combination of two antidepressants, like combining SSRI with St. John Wort, right? This is on Nclex. Nclex is always testing on this. Do not combine SSRI, because Clozapine is SSRI. Do not combine it with any other antidepressants, or most especially St. John Wort. And combination of these two will cause serotonin syndrome. Think about serotonin as the feel-good chemical. I made a video explaining these three types of antidepressants, SSRI, TCAs, and MAOIs. Go check them out, and so you understand this. So like I said, the right answer is serotonin syndrome, and this is life-threatening reaction from the combination of two serotonergic medications. So medications that contain serotonin, right? So that's why. Now let's go through the wrong choices. Malignant hyperthermia. This is triggered by anesthesia and not SSRIs, right? And B, neuroleptic malignant syndrome. This is also triggered by antipsychotics and not SSRI. I said SSRI is an antidepressant, okay? And lithium toxicity. For lithium toxicity, it involves tremors, GI upsets, okay? So the best answer here is serotonin syndrome. Now let's move on. Which of the following medications should be prescribed with caution to a patient diagnosed with anorexia nervosa? A. Fluoxetine. B. Sertraline. C. Lithium. And D. Lorazepam. Now, guys, you have to understand what is anorexia nervosa before you can answer this. Now, anorexia nervosa is eating disorder that is categorized by intense fear. In your nursing school exam or in Nclex, it's always there. Intense fear of gaining weight or distorted body image. This means when they look in the mirror, they see a very fat person, even though they are as thin as a broom or a toothpick. But when they look, that is where the distorted body image comes in. When they look at themselves, they see that they are very fat. And because of this, because they think they are very fat, eating disorder is a mental disorder. Because they think they are very fat, they start starving themselves, right? They start starving themselves from food. Now, you know, when you are starving yourself from eating, you are not eating. That means you are not getting nutrients. There will be electrolyte imbalance. There will be dehydration, right? So now that you understand what is anorexia nervosa, let's go through the choices, okay? So the first one says Fluoxetine, Sertraline, Lithium, and D. Lorazepam. And the right answer is C. Lithium. Why? Like I just explained to you that they are not eating, they are starving themselves, right? Because they have a patient that is diagnosed with anorexia nervosa, they are starving themselves, they are not eating. They will experience electrolyte imbalance. And with lithium, hyponatremia will cause lithium toxicity. And a patient that's already having electrolyte imbalance and are not eating, they are not getting the necessary nutrients and electrolytes, they are likely to have hyponatremia. So if you should give them lithium, they will experience lithium toxicity because they have low sodium. Because low sodium will cause lithium toxicity. Okay, right? And you know, I need you to know that lithium is also prescribed for bipolar. It's a mood stabilizer, and it's prescribed for bipolar. So it's prescribing lithium for this patient experiencing anorexia nervosa is dangerous or risky. Now let's go to the wrong choices. So our right answer is C, lithium. The wrong choices: Fluoxetine, Sertraline. These are SSRIs, and they are actually prescribed for them for patients with eating disorders to help them treat the underlying anxiety, depression, because some people have eating disorder because they have anxiety, they have depression, right? So they will prescribe Clozapine, sertraline for them to treat the underlying depression and anxiety. And the last one, lorazepam. This is benzodiazepam, right? And it's also used to treat anxiety, and it causes sedation effects. And since it has sedation effects, you have to be careful in prescribing it for them because they are not eating, they don't have strength, you know. Now that's why that answer is right. Let's go. A nurse is caring for a patient with bipolar disorder who is receiving lithium carbonate. Which of the following laboratory results should be reported to the healthcare provider immediately? A, serum sodium level of 138. B, serum lithium level of 2.0. And C, serum potassium level of 4.5. And D, serum glucose level of 110. Guys, let me explain something to you in this question. Even if you do not know, because they're taking lithium, you don't know what laboratory results should be reported. But look at the ranges of given to you. A, serum sodium level is 138. This is within the normal range because sodium level normal ranges is 135 to 145. So this is 138. This is within the normal range. Now look at B, serum lithium level of 2.0. Guys, normal lithium level, therapeutic level is 0.6 to 1.2. Anything over 1.5 is toxic. And this level is 2.0, very high. So this needs to be reported because anyone with serum lithium level of 2.0 will experience lithium toxicity. And for C, serum potassium level of 4.5. Normal potassium level is 3.5 to 5. This is normal. And serum glucose level of 110, absolutely normal. So the only odd one, the only one that is outside the normal range is B, lithium level. Okay, let's go. A nurse is caring for a client with binge eating disorder. What is the priority intervention? Encourage the client to join a gym. Monitor for signs of purging. Discuss healthy weight loss diet. And D, establish a structured eating schedule. Guys, the right answer is D, establish a structured eating schedule. Now let me explain this to you. A patient that has binge eating disorder, that means they just eat and eat and eat. Even if they are not hungry, they just want to keep eating. But when you establish a structured eating schedule for them, this helps them to manage the impulsive binge eating behavior. Now they know, okay, I'm gonna eat at this time, I'm gonna eat at this time. They are being able to help, can help them to control themselves. Okay, food is coming at this time, food is coming at that time, and that can help them to reduce or control the binge eating behavior. And that's why that's the right answer. Now let's go to encourage the client to join a gym, because you know when you are binge eating, you may gain weight. This is good, but it's not the first priority, right? Discuss healthy weight loss diets. Now this is good also, but if you should put them on healthy weight loss diets, they will feel restricted to a type of food, and that will trigger anxiety in them that, oh, I can't eat this, I can't eat that. Now that can even worsen the binge eating because they feel like, oh, they can't eat this. Because just think about, even we as normal human beings, sometimes when you wake up in the morning, you might not even eat till 12. But the day you want to fast, the day you think of fasting, that's when you start getting hungry from 8 a.m. And on a normal day, if you it's just a mental state. If you are not planning on fasting, you can actually go from 8 a.m. to 12 p.m. and not even be hungry. But the moment you realize that you're fasting, you can't eat things, you feel restricted, and that causes you to start getting anxiety. I can't eat this, I can't eat that. And that's the same thing. So if you should put them on weight loss diets so they cannot eat some certain type of food, they get triggered with anxiety and be like, oh, I can't eat this, and that's when they want to eat that particular thing, right? And B, monitor for signs of purging. This is more relevant in bulimia nervosa. You know what that is? This is a type of eating disorder that they will binge eat, and guess what? After eating, they start feeling bad, irritated about themselves. They want to cry, they break down, and then they start trying to throw up. They start taking things to purge them of the food they ate, and they start putting their hand in the mouth to trigger vomit, for them to vomit. So monitor for signs of purging will be for bulimia nervosa and not for binge eating like that, okay, for this particular patient. A client on Clozapine reports sore throat and fever. What is the nurse's priority action? A, advise warm salt water gargles. B, check white blood cell count. C, hold the next dose of the antipsychotic. And D, encourage fluids and rest. Okay, they are prescribed Clozapine. Guys, when your patients or a patient taking Clozapine is reporting sore throat and fever. This right here is a sign of agranulocytosis. And what is this? This is reduction or deficiency in white blood cell counts, right? And especially neutrophil. And you know what white blood cell does in the body? They help us to fight infection. So when they are reporting sore throats, you have to check white blood cell count. Actually, you have to call the healthcare provider and report the situation because they're on Clozapine. It is very rare, but it can happen. So if they are taking Clozapine, right? So, and that's why the answer is B. Now let's go through the wrong ones. A, I advise warm salt water gargles. Warm salt water gargles can actually just treat the symptoms of sore throat, but it is not treating the cause. Because what is causing that sore throat? These are signs and symptoms that is exhibiting from something, from the agranulocytosis, from reduction in the white blood cell. So you saying they should take advise warm salt water gargles is just treating the symptoms of sore throat. It is not really dealing with the cause. What causes that? What caused that sore throat? Right? C, hold the next dose of antipsychotic. Yes, you may hold the dose, but why are you holding the dose? You need to know that it is the medication that is causing the sore throat and fever before holding the dose. And how can you know? You need to check the white blood cell level, the WBC level, before you can confirm, okay, oh, it's the Clozapine they are taking that is causing that, let's hold it. And you just don't hold it. You hold it and you call the provider, because as nurses, you are not just allowed to hold the medication because you didn't prescribe the medication to them, right? So that's the function of the doctor. So after holding it, you have to call the healthcare provider. This is the situation. What are we going to do? Okay? Now, the next one. The nurse is assessing a client with bulimia nervosa. Which finding is most concerning? Tooth erosion, enlarged parotid glands. C, serum potassium level of 2.8, and D, scars on the knuckles. Guys, I explained what is bulimia nervosa for you guys not too long. Is be eating and feeling bad about it, feeling irritated and trying to purge themselves. Look at the serum potassium. Normal potassium level is 3.5 to 5, and this potassium is 2.8. So this is very low. And guys, if you've seen my videos, I always tell you, anything that is involving potassium, either hypokalemia, that is low potassium, or hyperkalemia, high potassium, you have to monitor for cardiac function, because potassium, either high or low, can cause cardiac arrhythmia, right? That is dysfunction of the cardiac rhythms, right? So with that, you have to monitor for potassium level. So this serum level of potassium 2.8 puts patient that have bulimia nervosa, put that patient at risk of cardiac arrhythmias, right? Because like I said, they try to purge everything they eat. They try to purge everything they eat. They try to throw up everything they eat. So they'll be experiencing electrolyte imbalance, okay? And so you have to monitor for their potassium level, because it's low potassium, high potassium will cause cardiac arrhythmias. Now let's talk about the wrong choices. Tooth erosion. This is very, very possible in bulimia nervosa. You know why? Because they get tooth erosion because when they try to put their hand in the throat to trigger vomit, you know, the food they ate now has mixed in the stomach, has mixed with some acid, and then on its way out, right, it's like chemical coming back, and then those chemicals can cause your teeth to go. Tooth erosion is when the teeth enamel is eating off, right? They will lose teeth. That can lead them to lose their teeth, right? And enlarged parotid glands. This is possible because this is the enlargement of this gland here, right? This is also common or possible in bulimia nervosa. And scars on knuckles. They get scars on knuckles because they are digging their hand in their throat to trigger them to vomit, and on the way out, their teeth can scratch the knuckle. So when you see that, when you notice these scars on knuckle with patients with bulimia nervosa, they've been triggering vomiting, okay? And that's that for that. Now let's go. A client with depression is prescribed amitriptyline. Which statement requires further teaching? That is wrong statement. I'll change position slowly to avoid dizziness. It might take few weeks before I feel better. I can stop taking it if I start to feel better. I should take it at bedtime. Now, amitriptyline is TCAs, right? And is a type of antidepressant that is under the TCA, right? Now, so let's go through the right answer is I can stop taking it if I start to feel better. This is the wrong statement you need to correct, because for antidepressants, you don't stop taking them. You don't stop abruptly. You taper them off, and that order has to come from the provider, the doctor. You just don't stop taking it because you feel better, right? Because it will cause exacerbation of the condition you're using it for. If they started using it for depression and you stop it abruptly because you feel better, it will come worsening depression, right? So that's why it's tapered off, and it's tapered off slowly. Okay, you don't stop abruptly or stop because you feel good. So for A, I'll change position slowly to avoid dizziness. This is actually true, because TCAs, like I said, they will cause dizziness and lead to orthostatic hypotension, sudden drop in the blood pressure. So they need to change position slowly. I can it might take few weeks before I feel better. Yes, it takes up to 2 to 4 weeks before you start seeing the therapeutic effect of any antidepressant. Now, I should take it at bedtime. Yes, because of its sedative effects, it's good to take it at bedtime. Okay, and also the TCAs, they also have anticholinergic effect. Can see, can spit, can pee, can poop. All right, remember that. Which dietary instruction is most important for a client taking phenelzine? Avoid citrus fruits, avoid aged cheese and smoked meat, increase fluid intake, limit potassium rich foods. Guys, the right answer is avoid aged cheeses and smoked meat. You know why? Now, phenelzine they are taking is MAOIs, and when any patient taking MAOIs, they put them on tyramine restricted diet. Go watch the video I made about all these antidepressants. They put them on tyramine restricted diet. That means they cannot eat food like fermented food, like aged cheese or fermented cheese, like it says here, smoked meat, curled meat, sour cream, yogurt. They cannot eat all of that, because if you combine tyramine food with MAOIs, it will cause hypertensive crisis. That is tyramine-induced hypertensive crisis. They'll have high blood pressure. So you have to avoid that. So that's why the right answer is avoid aged cheeses and smoked meats, because they will increase their blood. This food will increase the patient's blood pressure, right? So now let's go through the wrong choices. Avoid citrus fruits. Citrus fruit has no interaction with MAOI, so that's not the right answer. Increase fluid intake. It is good to increase your fluid intake. It is not the most important for patients taking MAOIs. It is not specific in this condition. And the last one says limit potassium rich food. That is not related to MAOIs, so it's out of the box. And the right answer is B. Now, which findings suggest that Clozapine has been effective for a patient with depression? The patient reports sleeping 12 hours per night. The patient begins showering and attending classes again. The patient isolates from peers, and the patient continues to express hopelessness. Guys, the right answer is B. The patient begins showering and attending classes again. So this is a positive effect. The therapeutic effect of taking Clozapine and SSRI is that now they begin to do what, because when they are depressed, they are isolated, they don't feel energy to do anything, they don't have appetite right now. But now the Clozapine is helping them to improve their mood, less depression, less anxiety, and now they begin to do what they used to do before. Here, look at what they say: attending classes again. They used to enjoy doing this, they used to do this before. Now they start with this medication, is now giving them therapeutic effect to start doing it back again. Okay, now, and they're providing self-care for themselves again. Now let's go. The patient reports sleeping 12 hours per night. This might still suggest depression, because how is it possible for you to sleep 12 hours throughout the whole night? 12 hours. That's you trying to isolate yourself, trying to not have social interaction with anybody. So that might still suggest depression. And the patient isolates from peers. Exactly. This is not suggesting improvements. This is not suggesting therapeutic effect of Clozapine, right? And the patient continues to express hopelessness. This is a major sign of unsolved depression. So they are still very depressed. Okay, let's move on. A nurse is assessing a patient diagnosed with generalized anxiety disorder who was prescribed lorazepam Ativan. Which of the following statements made by the patient should concern the nurse the most? I'll take my medication only when I feel anxious. I feel more relaxed after taking my medication. I drink 1 glass of wine every evening. I have started using lorazepam to help me sleep at night. Guys, let me break it down to you. The right answer is C. I drink 1 glass of wine every evening. You know why? Let me break it down to you. Ativan, lorazepam, is a benzodiazepine, and it's used for anxiety. Now think about it. It contains sedative properties, so it can cause sedation. And now they're taking alcohol with it. I drink 1 glass of wine every evening. Alcohol can also suppress the central nervous system, can cause sedation. So you combining these two together will cause increased risk of sedation, respiratory depression, and overdose. So that is why that is the right answer, right? The other statements are actually correct. I take my medication only when I feel anxious. Actually, you can take lorazepam or benzo as needed. Feel like they're about to have anxiety, they take it as needed. Okay, I have started using lorazepam to help me sleep at night. Yeah, lorazepam can also help insomnia, but should not be used for a long time as a sleeping aid, right? But it can help, and that's why that is right. Now let's go. A patient on SSRI is scheduled for surgery. What should the nurse report to the surgical team? The patient may develop low potassium. B, the medication must be held 24 hours before surgery. C, SSRIs may increase bleeding risk. And D, SSRIs increase the risk of infection. One thing you need to know about SSRIs are they inhibit platelet aggregation, that is, they decrease blood clotting, right? So they increase bleeding. So they are going for surgery, and if they go for surgery, they might be cut open. So if they are taking SSRI, they might be at risk of bleeding, and that's why the nurse have to report this to the surgery team that this patient is on SSRI, and then the doctor have to make a decision on what to do, if it needs to be held, if it needs to be held for just those time they're going for surgery. The doctor has to make a decision. Okay, so let's go through the wrong choices. The patient may develop low potassium. SSRI do not directly affect potassium, so that's out of it. Now B, the medication must be held 24 hours before surgery. So they are not routinely held unless specifically ordered by the doctor to hold the medication, and that's why I said earlier that you have to call the doctor have to make a decision. Okay, this patient is on SSRI, they have surgery, what are we gonna do? Okay, and SSRI increase the risk of infection. There's no strong link with SSRI and infection, so that is wrong. Now, a patient taking phenazil is found unconscious with blood pressure 220/120. What medication would the nurse expect to administer? A, naloxone. B, flumazenil. And C, phentolamine. And D, protamine sulfate. And guys, the right answer is C, phenethylamine. This is antidote for, you know what has happened in this situation? This patient is taking phenelphine, and this is a MAOI antidepressant. And look, they have high blood pressure. So what must have happened is this patient taking MAOIs have eaten tyramine food. Now they're experiencing hypertensive crisis. So look at their blood pressure is very high. Okay, so now you need to give them phentolamine to reverse the effect of the tyramine food they ate, right? And this will reduce the hypertensive crisis caused by the combination of two. So it will help to reduce their blood pressure. Okay, so let's go through the wrong choices. Naloxone. Naloxone is used for opioid overdose, right? Like fentanyl. Naloxone is used for that. B, flumazenil. This is used for as benzodiazepine of antidotes, right? And not for MAOI. And the last one is protamine sulfate. This is used as heparin overdose antidote. This is heparin antidote, not for MAOIs. Now let's go. A patient who just started an SSRI is more energetic and cheerful, but still experiences hopelessness. What is the nurse priority? A, document the improvement. B, continue to monitor every shift. C, ask if the patient has a suicidal plan. And D, discontinue the medication. Guys, the answer is obvious. C, ask if the patient has a suicidal plan. Like I explained in my other video that when they start antidepressant, the very first few weeks they start antidepressant, they have suicidal thoughts. Now listen, if they have suicidal thoughts before taking antidepressants, now that they are on antidepressants, they have energy to carry out their suicidal plan. Even though in the very first few weeks of taking antidepressants, their mood is not balanced yet. The medication doesn't have therapeutic effect on the mood yet, but it can give them energy. And now they have the energy to carry out their suicidal plan. And now watch and monitor your patient. When your patient is saying, I feel good, I want to go rock climbing, that is them trying to fall from the cliff, carry out their suicidal plan. If they say, oh, I feel better, I feel good now, and they're sharing their property, this is on Nclex. This is always, they will trick it, but this I'm telling you. So they say they start sharing their property, I feel energy, and start giving out their property because they feel like they're about to end it. Let them share their property. So monitor for, so ask them if they have any, ask if the patient has suicidal plan, and ask them, how do you plan to carry it out? So that's the right answer. Now, document the improvements this documentation alone is not sufficient. You need to ask them, right? Now continue to monitor every shift. Okay, you are monitoring them, but if you do not ask them what in the head, what are you thinking, start ask them. Because until you ask, they'll tell you, yes, I plan to, they plan to kill themselves, or they plan to, and they'll tell you how they plan to carry it out. They plan to use knife, they plan to use this one until you ask, right? And the last one, discontinue the medication. Stopping SSRI suddenly will worsen the depression, so don't stop suddenly or abruptly. Ask them, okay? Now let's go. A nurse is reviewing a patient's medication. Which combo increases serotonin syndrome risk the most? Sertraline and acetaminophen, Clozapine and Tramadol, Paracetamol and ibuprofen, citalopram and calcium carbonate. The right answer is B, Clozapine and Tramadol, because combination of these two medications raise serotonin level, the feel good chemical. Now they feel too good, and they have the energy, they are restless, agitated, all of that. So that's why that's the right answer. That will lead to serotonin syndrome. That's why we shouldn't combine that, Clozapine and Tramadol. Let's go through the wrong choices. A, C, and D, they have no significance in serotonergic interactions, so that makes them wrong. Now, a patient is taking Duloxetine and reports dark urine and upper right quadrant pain. What is the nurse's priority action? Administer antacid. Reassure the patient this is normal. Hold the dose and notify the provider. Ask the patient to drink more fluids. Now, what they are experiencing is the signs of liver injury. Okay, look at the signs and symptoms: dark urine and upper right quadrant. Upper right quadrant, and that's where your liver is. You know that, right? So they're experiencing liver injury. So the right answer is to hold the dose and notify the provider. Listen, I didn't say just hold the dose. Notify the provider, because the doctor has to make a decision. What are we going to do? Okay. Now, administer antacid. Why are you administering antacid? They are not having reflux. So why? That's not right. And you doing that, you are just delaying the proper intervention. They're having liver injury. You are delaying it. Reassure the patient this is normal. This is not normal. Right upper quadrant pain, not normal. Your liver is right there, it's not normal. And ask the patient to drink more fluid. Okay, drinking fluid is good, but it's still not treating the cause of the pain, right? So that makes it very, very wrong. Now let's go. Which of the following foods should a patient on phenazil avoid? A, cottage cheese. B, pepperoni pizza. C, grilled chicken. And D, fresh apple slices. And the right answer is B. They need to avoid pepperoni pizza. I know you all are eyeing cottage cheese, but cottage cheese is not aged cheese. Do we get it? I know you all are eyeing that cottage cheese, but pepperoni pizza is a cured meat, right? And that will trigger if they combine phenazine, which is MAOIs, with pepperoni pizza. Because you know, it's not think about the pepperoni. It's a cured meat, so it contains tyramine, because it contains salt too. It will increase their blood pressure. It will cause tyramine-induced hypertensive crisis. So cottage cheese is not old cheese. Cottage cheese is okay, and grilled chicken, fresh apple slices, these are actually safe food choices, except the pepperoni pizza. Let's go. We are almost there. Guys, if you have been enjoying or learning from this review, I want you to do me a favor by clicking the like button, by subscribing. That's the only support you can give unto us here. Okay, thank you. Now let's go. What is the priority teaching for a patient starting on MAOI? It may cause headaches. Call your provider if you experience dry mouth. D, do not take any over-the-counter cold medication. And D, you may feel better right away. And the right answer, the priority teaching for any patient taking MAOI is do not take any over-the-counter cold medication, because over-the-counter cold medication like decongestants can trigger hypertensive crisis, and that's why they shouldn't take it. Okay, that's why they should not combine MAOIs with decongestants, cold medication, over-the-counter cold meds. So let's go through the wrong choices. It may cause headaches. Okay, this is a non-urgent side effect of taking MAOIs. They can cause headache, so it's not urgent. Call your provider if you experience dry mouth. This is actually expected. It's okay. You may feel better right away. This is not a priority teaching, because they will not feel better right away taking antidepressants. It takes between 2 to 4 weeks before they start seeing the therapeutic effect of any antidepressant. So this is not a good teaching, right? So the only priority, you need to let them know, the only priority teaching, you need to let them know that do not take MAOIs with any over-the-counter cold medication because of hypertensive crisis. What is the best nursing diagnosis for a patient on amitriptyline, which is TCA, with dizziness and dry mouth? Nursing diagnosis. Now we are bringing fundamentals of nursing into this. A, risk for infection. B, risk for fall. C, fluid volume excess. And D, disturbed body image. Guys, the right answer is risk for fall. Amitriptyline, which is a TCA, and it causes dizziness and dry mouth. So nursing diagnosis for it is it can cause risk for fall. It can cause risk of infection, fluid volume excess, disturbed body image. These are not diagnosis for. Before you can understand what is diagnosis, look at what they gave you. Dizziness and dry mouth. Dizziness and dry mouth. Dry mouth is dehydration. Dizziness and dry mouth. And these two can cause fall. Because if you are dehydrated and you want to go get water, especially in older adults, okay, this can cause fall. So that's why it's risk of fall. That's the answer. Now, let's go. A nurse is teaching a patient about Trazodone. Which of the following should a nurse include? Select all that apply. It may make you sleepy, so take it at bedtime. Avoid drinking until you know how it affects you. You can drink alcohol in moderation. Report any prolonged or painful erection. E, this drug works instantly, so you will feel better right away. So a nurse teaching to a patient taking Trazodone, let's go through it as true or false. It may make you sleepy, so take it at bedtime. Absolutely, because it can help you it can be used for insomnia. So this may make you sleepy, so take it at bedtime. Absolutely. Avoid driving until you know how it affects you, because it may cause sedation effect. So you need to know how it affects you before you start driving machineries, okay? Heavy machineries. You can drink alcohol in moderation. No, they shouldn't drink alcohol, because especially the fact that it contains sedative effects, it can cause sedation. Alcohol can also do the same, so they shouldn't drink alcohol at all. Report any prolonged or painful erection. That's one of the side effects. It can cause sexual dysfunction or erection, painful erection. This drug works instantly, so you'll feel better right away. Like I've said throughout this video, any of the antidepressants don't work right away. Take 2 to 4 weeks before you see the therapeutic effect. And guys, that completes our review for today. Thank you. Until the next time.